Welcome to Physiology class. In this session, we will be discussing about cardiac output, which is one of the major essay questions being asked from cardiovascular system. So let's see each topic in detail. The first one is definition. Cardiac output refers to the amount of blood ejected by each ventricle per minute. That is, cardiac output is the product of stroke volume and heart rate. Now, what is stroke volume? Stroke volume is defined as the volume of blood ejected by each ventricle with each beat. So, the normal value is 80 ml. And heart rate is the number of times the heart beats per minute, whose normal value is 70 beats per minute. So by substituting these values, that is 80 ml in the place of stroke volume and 70 beats per minute in the place of heart rate, by multiplying it, we'll be getting a value of 5.6. And therefore, the normal cardiac output is said to be 5.6 liters, though its range varies from 5 to 6 liters. So that is the definition of cardiac output. Now let's see what is cardiac index. Cardiac index is the cardiac output expressed in relation to the body's surface area. That is, cardiac index is equal to cardiac output divided by body surface area. So by substituting the values, we will be getting the normal value of cardiac index as 3.2 liters per minute per meter square. So that is cardiac index. So of the total cardiac output, about 75 to 80% will be distributed to the all major vital organs, and the remaining 20 to 25% of the blood will be distributed to the skeletal muscles and other organs like skin and all. So that is all about the definition of cardiac output. Now let's see what are the factors affecting cardiac output. As I've already mentioned, cardiac output is a product of heart rate and stroke volume. All the factors affecting heart rate and all the factors affecting stroke volume will therefore affect cardiac output. Now let's see each one in detail. The first one is the factors affecting heart rate. So, stimulation of parasympathetic fibers or vagal fibers is always inhibitory to the heart, and stimulation of sympathetic fibers is usually facilitatory or stimulatory to the heart. And therefore, vagal stimulation inhibits heart rate and sympathetic stimulation stimulates heart rate. So once the heart rate is inhibited means it will result in the reduction of cardiac output, and once the heart rate is getting stimulated means it is increasing the cardiac output. So we can say that sympathetic stimulation results in increase in cardiac output, and stimulation of parasympathetic fibers results in reduction in cardiac output. So that is how the heart rate affects cardiac output. Now, the second factor is stroke volume. So, stroke volume is affected by multiple factors like preload, afterload, and myocardial contractility. So, let's see each one in detail. The first one is preload. What is preload? Preload is the end diastolic volume. So, increase in end diastolic volume increases stroke volume, and decrease in end diastolic volume decreases stroke volume. So what is end diastolic volume? This refers to the volume of blood remaining in the ventricle at the end of diastole. So this concept of preload is explained by Frank Starling's law, which states that within the physiological limit, the force of contraction is directly proportional to the initial length of muscle fiber. So depending upon this law, the factors affecting preload or how the preload is affecting cardiac output is being discussed. Now this end diastolic volume in turn depends on three major factors, and they are venous return, atrial pump activity, and ventricular compliance. So the first one under discussion is venous return. So venous return is the amount of blood that returns back to the right atrium from systemic venous circulation. That is, after pumping the entire blood from the aorta to different parts of the body, the deoxygenated blood which is being collected through the superior and inferior vena cava, that is finally draining into the right atrium. So that particular amount of blood is called venous return. Now this venous return in turn depends on several factors. The first one is skeletal muscle pump. That is, contraction of skeletal muscle compresses the vein and pushes the blood towards the heart, and therefore it increases venous return. And therefore it is said that during quiet standing for a longer period, pooling of blood occurs in the leg veins which decreases venous return. I repeat, skeletal muscle pump or the contraction of skeletal muscle compresses the vein and pushes the blood towards the heart. So pushing the blood towards the heart means it is increasing the venous return. So that is how the skeletal muscle pump take part in venous return. Now the next one is thoracic pump. Venous return increases during inspiration due to two reasons. The first one is the intrathoracic pressure becomes more negative during inspiration, and also the second one is fall in central venous pressure also facilitates venous return. So because of these two reasons, the venous return increases during inspiration. Now the third factor is abdominal pump. During inspiration, intra-abdominal pressure rises due to the descent of diaphragm. Therefore, increased abdominal pressure compresses the intra-abdominal blood vessels so that the blood is pushed towards the heart. Now, the next factor affecting is ECF volume or extracellular fluid volume. Increase in ECF volume, as in the case of pregnancy, increases cardiac output, and vice versa. That is, decrease in ECF volume, which is seen in diarrhea and vomiting, decreases cardiac output. So the last factor affecting the venous return is sympathetic activity. Stimulation of sympathetic system causes vasoconstriction, which in turn increases venous return. And also, inhibition of sympathetic system results in vasodilation, which decreases venous return. So these are the factors affecting venous return. I repeat, skeletal muscle pump, thoracic pump, abdominal pump, ECF volume, and sympathetic activity. Now the second factor is atrial pump activity. About 15 to 20% of the ventricular filling occurs during atrial systole. As we know that, or as we have already studied in cardiac cycle, that atrial systole causes only 15 to 20% filling. The remaining 70 to 75% of the blood will reach the ventricle even before the atrial systole. So, the atrial pump activity increases venous return. Now, the last factor is ventricular compliance. In pathological conditions like cardiomyopathies, ventricular filling decreases due to the decreased compliance of ventricular mass. So these are the three factors affecting preload. I repeat, venous return, atrial pump activity, and ventricular compliance. Now the second factor is myocardial contractility. Myocardial contractility, the factors that increases myocardial contractility are said to be positively inotropic, and the factors that decreases myocardial contractility are said to be negatively inotropic. So let's see the factors affecting myocardial contractility. The first one is ventricular muscle mass. In myocardial infarction or cardiomyopathies, we know that the ventricular muscle mass decreases. So decrease in myocardial muscle mass decreases cardiac output, and therefore usually in pathological conditions related with heart we can notice a reduction in cardiac output, and vice versa, that is increase in myocardial muscle mass can increase cardiac output. So that is all about the first factor. The second one is autonomic activity. Sympathetic stimulation increases ventricular contractility and vagal stimulation decreases ventricular contractility. The third factor affecting is hormonal factors. Catecholamines are positively inotropic, that is, it increases cardiac output. Insulin, thyroxine also increases cardiac output. So all these three hormones are said to be positively inotropic since they increase cardiac output. Now the next factor affecting myocardial contractility is chemical factors, which includes hypercapnia, which is an increase in the partial pressure of carbon dioxide level, hypoxia, which is a reduction in carbon dioxide level, oxygen level, and acidosis, that is increase in the H plus ion concentration. And also certain toxins can decrease contractility. So hypoxia, hypercapnia, acidosis, and certain toxins can decrease myocardial contractility. Now the last one is drugs. Certain drugs like digitalis inhibits myocardial contractility. Barbiturates also inhibits myocardial contractility. So how they inhibit the myocardial contractility is they inhibit the sodium potassium ATPase pump activity. So as we know that sodium potassium pump is the pump which is present in all the cells of a human body. So the inhibition of these cells will naturally result in the inhibition or reduction in the myocardial contractility. So these are the factors affecting myocardial contractility. So we have already discussed about preload and myocardial contractility. Now the last factor affecting the stroke volume is afterload. Afterload is defined as the force against which the ventricular muscle fibers shorten. That is, peripheral resistance is considered as the afterload. And the cardiac output varies inversely with afterload. Hence, it is called homometric autoregulation. It is because the cardiac output changes without change in ventricular muscle length. So that is all about afterload. So these are the three factors, that is preload, myocardial contractility, and afterload are the three factors affecting stroke volume. Now let's move on to the variations. When is the cardiac output increased or decreased? So let's see the physiological variations first. The first one is age. Cardiac output is less in elderly. It is due to the reduction in heart rate and stroke volume as age progresses. The second one is diurnal variation. In early morning, cardiac output is low, which increases in the daytime. The third factor is anxiety and excitement. It increases cardiac output by 50 to 100% depending upon the sympathetic stimulation. The next one is after meals. After meals, you can see an increase in cardiac output by around 30%. The next one is exercise. Exercise increases cardiac output as sympathetic stimulation increases heart rate and myocardial contractility, thereby increasing cardiac output. So it is a sympathetic stimulation which increases cardiac output while doing exercise. The next factor is pregnancy. In pregnancy, cardiac output increases due to the increase in blood volume, as we have already mentioned, which is due to the expansion of ECF volume. And the last factor is in high altitude. Cardiac output is increased due to release of adrenaline as a consequence to hypoxia. So these are the physiological variations in cardiac output. Now let's see the pathological variations. In fever, anemia, and hyperthyroidism, the cardiac output increases. In fever, the cardiac output increases due to increased oxidative processes. In anemia, the cardiac output increases due to hypoxia. And in hyperthyroidism, it is due to increased metabolism, the cardiac output increases. So these are the pathological increase we noticed in cardiac output. Now let's see the pathological decrease conditions. The first one is arrhythmia. It is due to incomplete filling, the cardiac output is getting reduced. The next one is congestive heart failure. It is due to the weak contraction of the heart, the cardiac output is unable to pump sufficient amount of blood. The third condition is hemorrhage. It is due to decreased blood volume, the cardiac output is getting reduced. And the last one is hypothyroidism. In hypothyroidism, the metabolism is reduced and therefore the cardiac output is also reduced. So these are the factors in which, these are the pathological conditions in which you can see a reduction in the cardiac output. So these are the factors affecting cardiac output. Now let's see how the cardiac output can be measured. Cardiac output can be measured by from different methods. The first one is using an electromagnetic flow meter, an indicator dilution method, echocardiography, and X-ray method. In X-ray method, a radio-opaque dye is injected intravenously and then the size of the heart is detected by serial X-rays in systole and diastole, from which cardiac output is measured using computed programs. The next one is echocardiography. It refers to the ultrasonic elevation of cardiac functions. It is useful in detecting valvular lesions and to detect the size of chambers. The next one is indicator dilution method. In this method, a known volume of dye is injected into a large vein, preferably into the right atrium, by cardiac catheterization. And then the cardiac output must be equal to the amount of indicator injected, right? And it is then calculated using certain formulas like F is equal to Q by CT. So you don't have to go much detail into that. You just have to define what is indicator dilution method. And the last one is electromagnetic flow meter. Cardiac output can be measured directly by placing an electromagnetic flow meter in ascending aorta or by using cardiometer. The disadvantage of this method is that it can be used only in experimental animals or in humans undergoing open heart surgery. So this is how the cardiac output can be clinically measured. And these are the previous year questions. Define cardiac output and cardiac index and mention their normal values. Explain the factors influencing cardiac output, which was asked for essay. The next question is define cardiac output and describe the factors regulating cardiac output. So here you have to write in detail about the factors affecting heart rate as well as factors affecting stroke volume. Then define stroke volume, write its normal value. The next question is define cardiac output and mention its normal value. Describe the factors regulating cardiac output. Again, repetition of the second question. The fourth question is define cardiac output. What are the factors regulating cardiac output? It was asked for 5 marks. Then the factors affecting cardiac output again for 5 marks. So from this, we came to the conclusion that cardiac output, if it is asked as an essay question, then as a sub question, they will be asking about the factors regulating. The factors regulating cardiac output can be asked as an essay, a short essay, or a short note question. So depending upon the mark or according to the mark, you have to cut short your answers. Make sure while writing the answer, you have to describe all the factors affecting heart rate and all the factors affecting stroke volume, including preload, afterload, and myocardial contractility. So that is all about cardiac output. I hope the concept is clear. Thank you.